Inquisitive. Walk into any coffee shop or health food store today, and the trend is impossible to miss. Medicinal mushrooms are everywhere. The packaging often relies on mystical imagery to sell a specific promise that these fungi can optimize your brain, your energy, and your immune system. But it's worth asking if we're looking at a genuine biological breakthrough or simply an expensive wellness trend supported by marketing rather than chemistry. To find the answer, we have to look past the influencers and evaluate these organisms based on the strength of their human clinical trials. When you strip away the branding, the research falls onto a clear ladder of evidence, starting with emerging science in sports and sleep and climbing toward high-stakes medical oncology. The first rung of our ladder focuses on physiological optimization, the frontier of sports science and stress regulation. Take reishi mushrooms, for example. They contain triterpenes, compounds that researchers are studying for their ability to lower cortisol and help the body regulate its internal response to stress. Then there's cordyceps. This cellular diagram shows how its compounds can increase the production of ATP, the energy currency of our cells. Clinical data suggests this leads to better oxygen utilization during high-intensity exercise. These studies are promising for biological optimization, but because many are still in early stages, we categorize this evidence as emerging. As we move to the next rung, the focus shifts from physical performance to the targeted maintenance of the human brain. This is where lion's mane sits. It contains hericenones and erinacines, molecules that have been shown to stimulate the synthesis of nerve growth factor, the protein that helps neurons grow and survive. In a 16-week trial of older adults with mild cognitive impairment, researchers tracked a steady climb in cognitive scores, suggesting a measurable improvement in brain function while taking the extract. But there's a catch. Just 4 weeks after the participants stopped taking the supplement, their scores dropped back to their original baseline. The data shows that lion's mane is a functional tool for cognitive support, but its effects are conditional on consistent daily use. The apex of the ladder moves us out of the supplement aisle and into the high-stakes environment of modern oncology. In Japan, clinicians prescribe a turkey tail derivative called polysaccharide K, or PSK, as a regulated medical treatment for cancer patients. The data behind this is substantial, including a meta-analysis that followed more than 10,000 patients with gastrointestinal cancers. Chemotherapy is notoriously hard on the body's defenses, but the beta-glucans in PSK act as immunomodulators, actively rebuilding the immune cells that the primary treatment often destroys. When patients added PSK to their standard chemotherapy, researchers found that overall survival rates significantly increased across a 7-year period. This level of data demonstrates that when extracted and used correctly, specific fungal compounds function as powerful interventions in critical care. These findings suggest we should view medicinal mushrooms as biological factories, complex organisms capable of producing specific, high-potency molecules. The most effective way to use them is as adjuncts, targeted tools designed to support immunity, cognition, or endurance alongside traditional medical care. To get these results, however, quality matters. This graphic shows why you should look for fruiting body extracts, which contain a much higher density of active compounds than the root-like mycelium often found in cheaper powders. This intersection of traditional use and clinical pharmacology is now providing a measurable framework for integrating fungi into modern healthcare. Ultimately, the best way to approach fungal medicine is to ignore the wellness hype and let the peer-reviewed clinical evidence dictate your strategy.